Uh, and we're live on YouTube. Okay po. Yusek, we can start na po from the question of Fred Mendoza of the Manila Times. Pwede lang po makahingi ng clarification about the most dominant variant na ni-refer ni Secretary of Health sa Talk to the People speech last Monday. Baka po kasi ma-misconstrue na it has become dominant in the country, pero in reality, it's just around 18% ng mga na-sequence natin na around 5,000 samples, which in reality does not constitute a national sample. Yusek?
Tama yan, Red, no? So let us all clarify at this point. Gusto lang ho natin ipaalam, ang B.1.351 or the South African variant, siya yung merong pinakamadami tayong na-detect among those sampled for whole genome sequencing. It doesn't mean na ito yung dominant na variant dito sa atin ngayon sa Pilipinas. Ang atin pong sinasabi lang, ang sinasabi rin ni Secretary, sa tingin ko, which was taken out of context, was this, ngayon, itong South African variant, siya na yung pinakamadaming may na-detect tayo among these 7,000 plus samples that we have already processed for whole genome sequencing. So just so that we are all clear on this, 18% na meron tayo is for South African variant, 16% is for the UK variant, and then we have 2.6% for the P.3, and we have 0.03% for the P.1. So yan po yung mga binabantayan natin ngayon sa ating biosurveillance.
Thank you, ma'am. Next question po. Pa-reiterate lang po ng advice ng DOH regarding those people na nabakunahan ng flu, pneumonia, or any other antibacterial viral shots before or after getting a COVID-19 vaccine. Ilang days or weeks po bago sila mabakunahan ng COVID vaccine. Saka yung mga nabakunahan na rin po ng COVID-19 shots, how will they be able to receive a flu or other antiviral shots after taking the COVID vaccine?
It's the same, no? So Red, it's 14 days before or even after COVID-19 vaccine. So for example, ang ating mga kababayan, nakapagpabakuna po kayo ng anti-rabies o di kaya anti-tetano o kahit ano pa hong klaseng bakuna, kailangan po may 14 na araw na pagitan bago kayo makapag-receive ng COVID-19 vaccine. It's the same also if you received COVID-19 vaccine and you need these shots, kailangan po 14 na araw na pagitan. Pero meron po tayong parang kolatilya dyan. Kung talagang emergency in nature at kailangan ng bakunahan, the benefit will outweigh the risk, so we give that specific vaccine, no? Kahit nakakabakuna ko pa lang ng COVID-19 vaccine, for example, tapos na aksidente po tayo, kailangan ng anti-tetano. So kung nakita natin na emergency po yung nature, alam po ito ng ating mga doktor, babakunahan na po siya ng anti-tetano na yun.
Thank you, ma'am. From Caroline Joaquin as well as from Lay, si Lay po nagtatanong kung ano po ang assessment ng WHO experts sa transmission level ng variants of concern sa bansa. From Caroline naman po, Yusek, based po sa genome sequencing kahapon, almost half ng samples ay P.1.3.51 or P.1.17. At this time, pending WHO official report, masasabi na po ba na prevalent ang dalawang variants na ito and saang lugar po pinakamarami ang new variants?
Hindi natin masasabi, no, Caroline and Lay, until this point, because as we've said, we're only doing sampling. And yung sampling natin, purposeful yan. Ibig sabihin, we get samples from those areas with clustering of infections, with linkages to specific individuals who turned positive for these variants, dun po sa mga areas na closed ng institution, dun sa mga returning travelers natin. So ito po, purposeful ang ating surveillance, so hindi pa natin mas ascertain kung talagang sila na yung prevalent na variants dito at saka kung sila na talaga yung meron na tayong masasabi that we have this community transmission. That's why WHO until now cannot give that classification yet because they need further study so that we can be able to determine if really there is community transmission already from these different types of variants. The second question, saan ba siya pinakamadami? Doon po alam natin in NCR at saka doon sa Region 4A, nandito po yung ating mga bulk of cases for both South African and UK variants.
Thank you, ma'am. Still from Caroline Bonkin, Tracing Czar Benjamin Magalong said that the number of undetected cases is possibly high due to poor contact tracing. Does the DOH agree with this po and may estimate na po ba kaya kung ilang % pa ang hindi na-detect?
Well, unang-una, we recognize that fact na among our different responses or strategies that we are doing since the start of the response, isa ang contact tracing sa medyo weak ang ating response. And ito naman po ay talagang sinusugan ng suporta ng DILG, ngayon po ang DOLE giving us that support para makakapag-hire pa tayo ng additional contact tracers, no? So ang atin po ngayong average, no, of being of contact tracing, especially here in NCR, if we try to look at that, it varies, no? May mga extreme na talagang local government na mataas talaga yung kanilang contact tracing ratio. Meron naman iba until now nasa 1:5 or 1:6 pa rin tayo. An ideal number was set by the contact tracing czar at the outset of this response, no? At binaba na nga po sa 1:15. Pero hindi pa rin ho natin na-attain yan because of a lot of factors actually. But one thing that we can tell you, no? So kapag sinabing maraming undetected, that is a possibility, yes. But we have to look at the classification of our cases right now. So when we say undetected, because you were not able to trace them through contact tracing, and because siguro hindi sila nag-show ng symptoms, kaya hindi talaga makikita ng ating mga contact tracers o ng local governments. Pag tinignan natin yung classification ng mga disease as based on severity, you'd find that about 2 to 3% only are asymptomatic. Ibig sabihin, wala silang simptomas. With the current intensive efforts that we are doing right now, like doing house to house, we can very well detect or identify those with symptoms and extract them for isolation. So yung mga asymptomatic po, siguro yun ang hindi natin talaga masyado nakikita hanggat sa ma-intensify pa natin yung contact tracing efforts natin.
Thank you, ma'am. From Greg Gregorio of TV5, may data po ba tayo kung ilan po ang nabakunahan ng Sputnik V kahapon sa launch and initial implementation?
Yes, there were 15,000 doses that were deployed to 5 major cities in Metro Manila. And this would be Manila, Makati, Parañaque, Taguig, and Muntinlupa. Yesterday, ang nag-umpisa lang ay ang Parañaque, Manila, and Makati. Ang Taguig at saka Muntinlupa, ngayon sila mag-uumpisa nitong Sputnik V inoculations. Kahapon ng Parañaque, they were able to vaccinate 2,100 individuals para po dito sa initial dose ng Sputnik V. Sa Manila po, 165 in Santa Ana Hospital, and most of them are healthcare workers, no? Just for your information. And then for Makati, we had 369, giving a total of 2,634 vaccinees as of yesterday with the Sputnik V vaccine.
Thank you, ma'am. From Aiko Miguel of UNTV, sa US, posibleng aprubahan na ngayong linggo ang EUA para sa bakuna sa mga bata. Ano na po ang plano o ginagawang aksyon ng gobyerno hinggil sa pagbabakuna sa mga bata kontra COVID-19? Kung kinukonsidera po ba nila muling ang pagbubukas ng face-to-face classes, hindi po ba dapat unahin ang bakuna sa mga bata para may protection sila?
Aiko, pag tinignan natin yung mga programa natin sa Department of Health, wala pang COVID-19, makikita natin na napaka-strong ng ating programs for children because we know that they are very vulnerable. And when we look at the National Immunization Program of DOH, of the government, para sa mga bata talaga nakikita natin yung bias. Dahil alam natin, dapat bata pa lang na pro-protection na natin ang ating mga anak, ang ating mga kabataan. Ito pong balita ngayon that Pfizer was already able to do the clinical trial among 12 to 15 years old children. Napakagandang balita niyan, ano? And it is very much welcome kung makakakuha tayo ng ganito and mabibigyan ng EUA ng US and makasunod ang ating bansa para makapagbigay ng EUA. So also we can protect our children. Pero sa ngayon, iyan po ay kailangan pa rin pag-aralan. Pag may lumalabas po mga ganitong publications, hindi po inaantay ng ating mga eksperto na pag-aralan yan pag nag-submit pa lang sila. Sa ngayon pa lang, pag na-publish na yung mga information na yan, pinag-aaralan na natin. And once na-approve yan, and magkaroon tayo ng ganyang bakuna, and then very well, no, it's very much welcome by government that we can also inoculate this sector of the population.
Thank you, ma'am. From Tina Panganiban of GMA News, paano mapapangalagaan ang mental health ng health workers and those caring for COVID patients?
Meron tayong mga iba't ibang polisiya na nailabas simulat sa fall nitong pandemya na ito, Tina. No? So we were able to issue out an administrative order coming from DOH so that we can be able to instruct our regional offices and local governments on how we can take care of the mental health of our healthcare workers, and not just healthcare workers but the community as a whole. Kasama na dyan yung mga nagbabantay ng kanilang mga kapamilya na merong sakit na COVID-19. Aside from that, sinusugan pa yan ng DTI at saka ng DOLE, nagka-joint memo circular sila ng tungkol sa workplace prevention and control, wherein mental health was part, no, of these provisions na dapat pangalagaan ng mental health ng ating mga workers. So having said all that, meron po tayong mga enablers para magawa natin yan. Ano? Meron po tayo yung sa National Center for Mental Health natin, nagpapadala po sila regularly sa ating mga ospital ng mga MPHSS teams. No? Ito po yung mga teams natin which evaluates the mental level or status of our healthcare workers in our hospitals, give them counseling, debriefing, para naman po nagkakaroon sila nitong regular mental counseling or counseling, no, for them so that they can be able to distress as well. Aside from that, we have set up hotlines already. Na-expand na ho natin itong hotlines ng ating NCMH, yung USAP na 0917-899-USAP, kung saan dito po tumatawag ang ating mga kababayan. And we have seen an increase in the number of calls since the start of the pandemic, especially when there are increases in the number of cases, talagang tumataas po ang tawag nila sa atin. And also, private sector has been helping since the start. Meron hong mga hotlines ng private sector na kanila pong i-share na rin sa DOH para ma-disseminate natin. Ano? And this would include institutions, private NGOs, yun pong mga civil society, meron pong mga iba't ibang platforms po sila. So ito po ang mga nakakatulong ngayon sa atin para we can maintain and ensure that our healthcare workers and those carers in the community are given these mental health program services.
Thank you, ma'am. From Jenna Balaor of GMA News, may data po ba ng mga hindi nakabalik for second dose?
Meron na tayong mga reports, no, na tatala o na ibibigay sa atin na tinitignan natin that compared to the first dose ng mga bakuna, yun pong mga pumapasok na mga reports, hindi sila nagmamatch, no, na second dose. Maaring because of the time period, no, hindi pa naman po tapos yung time period na binigay for the second dose schedules of our individuals. Pero meron din po tayo nakikitang common reasons kung bakit yung second dose ay hindi nagagawa. Unang-una na po yung delayed reporting. So we have to remember, kailangan maintindihan po ng ating mga kababayan, ang mga report po ng pagbabakuna o hindi pagbabakuna ay binibigay sa atin ng local governments natin at iniipon po natin yan sa pang-araw-araw nating pagbibigay ng tala sa ating publiko. And there are really delays in reporting. Kaya minsan nakikita natin medyo mabagal o di kaya kulang ang datos because of this. Second most common reason would be deferrals because nagkaroon ng sakit yung taong dapat bakunahan for the second dose. Maaring nagkaroon ng COVID-19 o maaring nagkaroon din ng ilang issue regarding their health kaya hindi po natuloy ang kanilang pagbabakuna. So ito po ang pangatlo, yung iba naman nagpa-second dose po sa ibang lugar at nakakapagbigay na lang sila ng report kapag tinatawagan na po sila ng ating vaccination units. So ito po ay isa rin sa mga dahilan kung bakit po ganyan. And the rest po, atin pa hong iniipon, no, para mabuo natin ang mga datos na ito at makapagbigay tayo ng tamang numero.
Maraming salamat po, Yusek. Ma'am, I'll be going through the questions that are sent in the chat. The first question po from Carolyn, if someone who just had first vaccine jab still caught the virus, can that person get the second shot or back to first shot po ulit?
Yes, Caroline, no? So ito pong mga kababayan natin na nabakunahan na ng first dose nila tapos nagkaroon sila ng COVID-19, no? In between these doses, as soon as they recover, nasabihan na sila ng kanilang doktor na sila ay recovered na o nakapagsabi na rin ng local government that they had been able to finish already this period, no? At sila ay recovered na, maari na po silang tumanggap nitong bakuna.
Thank you, ma'am. From Bons Magsambol of Rappler, the DOH says it would recommend that travelers in the country be tested for COVID-19 on the 7th or 8th day. May we know the logic behind this recommendation po?
Yes, these are based on evidences, no? And pinakita ito ni na Dr. Edsel at ng iba nating technical advisory group members based on evidences that on the 7th and the 8th day, nandun yung pinakamataas na porsyento that a person who might have the disease might turn positive. Although hindi natin dinidiscount yung fact na maaring meron na first, second, third, fourth, fifth. Pero pinakamataas po because the viral load is high is on the 7th and 8th day. And for us to be able to have accurate test results at mai-isolate natin agad ang may sakit, ay ito po ang atin pong nire-recommenda ngayon. Although itong sinabi ko kaninang umaga sa interview ko, ito po ay kailangan pang pag-usapan sa IATF. We are just being factual. We are just giving evidences to state kung bakit po natin ito nire-recommenda.
Thank you, ma'am. Still from Bonds po, WHO says it found very low level of confidence in Sinopharm vaccine for older adults. But this is also the vaccine that was administered to the president. May we know if may recommendation na po ba ang VEP, FDA, or DOH if okay gamitin ang Sinopharm for the elderly?
Alam po natin ang proseso, no? So all of these manufacturers has to go through our regulatory process. At doon po nag-uumpisa ang pag-aaral. At saka hindi po nagbibigay ng rekomendasyon ng ating mga eksperto at ang FDA hanggang hindi po formal na nag-a-apply ang manufacturers. So they might be studying also already the publications from this specific vaccine, pero as long as it is still not official, we cannot give official recommendations. So sa ngayon, pag-aaralan pa ho yan, kung sila ay magsasubmit para makita natin kung papasa po dun sa sinasabi nating mga standards para makapagbigay ng EUA.
Thank you, ma'am. The second question po of Vivian Gula, how many experienced side effects from Sputnik V so far? What kind? Are they any different from the side effects of Sinovac and AstraZeneca?
Well, based on the studies of the vaccine expert panel, nakapaglabas po sila, commonly, ang side effects ng Sputnik V would be the pain in the inoculation site and yung more common symptoms na nararamdaman din ng mga kababayan natin sa ibang bakuna, yung parang tinatrangkaso, masakit ang katawan, masakit ang ulo. So ito lang po yung nakita natin. And actually, sabi nga ng vaccine expert panel natin, generally safe ang Sputnik V based on their evaluation.
Thank you, ma'am. From Aiko Miguel, may update na po ba sa home care package discussed with PhilHealth?
Yes, no? So we had a meeting last week at nabuo na rin naman po ito. So we just need to wait for PhilHealth because they still need to discuss this with the PhilHealth board for approval because lalagyan na po iyan ng cost, lalagyan na po iyan ng mga mechanisms on how to do that. So we will wait for PhilHealth to get the board approval for this home care package so that we will be able to implement soon.
Thank you, ma'am. Ma'am, there's a question po from Julia Ornedo. During the Sputnik V rollout in Parañaque yesterday, many residents who lined up were upset because they were left hanging when the doses ran out. Hindi po ba na-inform ang residents kung ilang doses ang available? Ano po ang advice ng DOH sa public before heading to vaccination centers? And how should local government manage the line of people waiting for vaccines?
Actually, kailangan nating klaruhin to, no? Ang Parañaque government, they already announced to their citizens bago sila nag-umpisa nitong activity nila kahapon. Only those master listed and with schedule shall be accommodated, no? So kahapon po 'yan. Ang nangyari po siguro may mga iba na tayong kababayan na nagpunta doon that they were not part of the schedule kaya po hindi na sila nabigyan. Although ang Parañaque government kahapon nung nakita naman nila na meron pa silang sobra aside from those master listed, nagpamigay pa rin. Kaya lang hindi po ine-expect na ganun kadami ang pupunta talaga because hindi naman po nga widely disseminated at schedule nila yung mga pagbabakuna. But I guess mga Parañaque citizens natin talagang gusto na po nila magpabakuna kaya talagang marami nagpunta. Huwag po kayong mag-alala. Meron pa ho tayong mga bakuna na parating at may mga stocks pa rin ho sa Parañaque government natin. If it's not Sputnik V, we still have other vaccines that are in stock in our local governments. At lahat po ng eligible ay mabibigyan itong bakunang to.
Salamat, ma'am. From Rafael Posano, the South African variant seems to be more dominant variant among the samples where a VOC was detected based on the genome sequencing results. Efficacy of a lot of vaccines being used seemed to be reduced by the variant. Given that we don't know how many more people are infected with the South African variant, is this something that concerns the Department of Health? How would this affect the level of protection in terms of contracting the disease?
Well, Rafi, alam mo, pinag-aaralan yan. Ano? Hindi lang naman ngayon yan lumabas. Lumabas na yan simulat sa poll na lumalabas na itong mga characteristics ng mga iba't ibang variants na lumalabas sa ngayon. And sabi nga nila, itong South African variant, meron siyang phenomenon, itong immune escape. So based on publications, based on evidence, pag tinignan natin, meron silang pag-aaral sa bawat bakuna, what would be the affectation of this variant with this specific vaccine. And until now, mga initial pa lang ng mga pag-aaral yan. Wala pang mga full evidence na masasabing talagang hindi siya epektibo. So therefore, WHO and even the experts have recommended, not just local experts, but international experts also, that because the benefit will still outweigh the risk, we continue on vaccinating our citizens here in the Philippines.
Thank you, ma'am. From Red Mendoza po, Yusek, if you have any details daw po sa Moderna EUA?
Wala, naglabas na ngayon. Kanina, I heard Yusek Eric having announced that the EUA for Moderna has already been issued. So as to details, yan. Alam natin na ang kanyang storage is different from the rest. So alam natin na ang storage niya would be from -25 to -15 dapat. Ito ay ibibigay sa 18 years old and older. So for the other things, nakapublish naman po itong EUA, maaari po natin yan i-check sa FDA website and even in the DOH website kapag naibigay na po sa atin ang kopya.
Thank you, ma'am. From Paul Samarita of TV5 News, according to South China Morning Post, Hong Kong reported at least 3 COVID infections among domestic helpers, with one coming from the Philippines, wherein the N501Y variant was seen. But authorities cannot yet confirm if the person contracted the virus locally, since there are antibodies present in the person's body, suggesting that he or she may be infected earlier. We ask if this case was picked up by the DOH, and does the department have a list of Pinoy domestic workers who contracted COVID-19?
Well, we are currently coordinating. As soon as we heard of this news, we are coordinating now through our International Health Regulations Network para makuha namin yung specific details nitong domestic Filipino worker. Apparently, na meron siyang ganitong N501Y. Kailangan natin makuha yung detalye, kailangan natin makuha yung time periods ng pag-travel, pag-alis dito, pagdating doon, ilang araw bago siya na-detect na positive o kung kailan nagawa yung sequence process nila. So kailangan ho namin makuha lahat ng detalye before we can give accurate information on this.
Thank you, ma'am. From Catherine Gonzalez, may we know ilang percentage po ng cases ng B.1.1.7 and B.1.351 variant sa Pilipinas ang nasa NCR and Region 4A?
We will compute for the percentage, but for NCR, we have 358 cases of the UK variant, 602 cases of the South African variant. We have 39 cases of the P.3. For Region 4A, we have 145 cases of the UK variant, 121 cases of the South African variant, and 6 cases of the P.3. As to percentage, we will be giving it later in the Viber group.
Salamat po, Yusek. From Lay Alves, may resulta na ba ang test ng mga naka-quarantine na pasahero galing India na dumating bago ang travel ban? Mapipigilan ba ang pagpasok ng B.1.617 variant sa bansa, or is it only a matter of time din lang gaya ng pagpasok dito ng UK at South African variant?
Well, Lay, that's the hope, that we can prevent the entry of specific variants into the country. Yun din naman ang objective natin nung nag-restrict tayo ng ating borders for the UK variant. Kailangan lang natin talagang pag-igtingin ng border control na kahit na makapasok man sila, itong mga variants na ito, dapat handa tayo. So kailangan lang laging paalalahanan ng ating mga kababayan na kahit ano pa hong variant ang meron dito sa ating bansa at makapasok sa ating bansa, kailangan lagi po tayong protektado. So continue on doing the minimum public health standards because that will protect you from these variants. As to these Indian travelers that were quarantined upon arrival here before the restrictions were imposed, 110 po sa kanila ay nagkaroon na ng pagsusuri or pagtetest sa kanila. 6 turned out to be positive and it is now submitted to the Philippine Genome Center for whole genome sequencing. Meron pong 6 na hanggang ngayon ay nilolocate pa rin natin out of this 117. No? So bibigyan natin kayo ng information as soon as makumpleto natin ang mga datos natin.
Thank you, ma'am. A clarification po from Caroline. Paano po pag nagkasakit tapos hindi nakuha agad ang second dose? Back to first shot po ba dahil na-miss na ang recommended na dosing period?
Actually, nung tinanong namin ito sa ating mga experts, no, and their experts are saying that with the existing vaccines that we have aside from COVID-19, kahit 1 taon na yung interval mo na hindi mo nakuha yung second dose mo, ibinibigay na lang yung second dose mo as soon as you go to your doctor. So ibig sabihin, you do not need to repeat your first dose. So ito po ay atin pong pinag-aaralan pa rin, pero ito po ngayon ang status quo natin. Ano? So kung ilang months ang hindi niya nakuha yung kanyang second dose, we give it, no? We don't repeat the first dose. Pero kailangan paalalahanan ng ating mga kababayan, huwag ho tayong magpapatagal. As soon as we recover from whatever illness you have, magpabakuna na po tayo. No? Kasi mas maganda na nasusunod pa rin natin yung intervals na sinabi nung bakuna at ano manufacturing as indicated, no? Para po tayo ay magkaroon ng mas maayos na protection for this vaccine.
Thank you, ma'am. From Jenna Balaoro, sabi ni Dr. Agbayani, pro-ivermectin at President ng Concerned Doctors and Citizens, na publish na ang medical paper ni Dr. Pierre sa American Journal of Therapeutics. And this means may recognition na raw na legitimate ang studies niya on ivermectin as COVID treatment. Ano po ang pananaw niyo dito and do you share the same interpretation?
Well, we are in the Philippines. So I guess kung ano man yung protocols natin dito at saka regulatory processes, that is what we are going to follow. Pag-aaralan po yan ng ating mga eksperto at patuloy naman talagang pinag-aaralan po. Katulad ng lagi namin sinasabi, we are not closing our doors to these investigational drugs. We evaluate each study that comes out. Pinag-aaralan po ng ating mga eksperto yan. At talaga namang sila ay unified in that stand na sa ngayon, wala pa rin po talagang benepisyong maibibigay sa ating mga kababayan. So whatever studies that might be published abroad, we study that. But again, let me reiterate, regulatory and the pathway for processes for this kind of drugs being used or to be used here in the country will have to undergo the Philippine government's regulatory process.
Thank you, ma'am. From Reyna Tolentino of the Manila Times, House Speaker Velasco said that he wants unregistered nurses to be tapped as additional cadres for health workers. Ano po ang reaction ng DOH sa proposal ni Representative Velasco?
Well, lagi naman ho tayong bukas sa kahit na anong rekomendasyon basta makakatulong sa ating gobyerno dito sa response. Lalong-lalo na nga ngayon na nangangailangan talaga tayo ng mga healthcare workers natin. Ito po ay isa sa mga tinitignang mga paraan, even at the start. Katulad nga po ng mga ating mga medical doctors na nandun pa lang sila na hindi pa sila nakakapag-board exams. Ito po ay isa sa pinag-isipan at actually some local governments have done this, na tinap nila yung mga underboard natin ng mga doktor para magman nung kanilang mga facilities for primary care. So, eto, bukas tayo. Pero sa ngayon po kasi, ang pinag-uusapan with the Philippine Nursing Association, kasi may Nursing Act po, nakalagay po dun sa Nursing Act, ang pwede lang na mabigyan ng special or temporary permits would still be the licensed nurses. So, meron hong mga ganun na provision sa law. So, sa ngayon, ang kausap natin ng PNA, kausap natin ng PRC, ang isa na nga pong hiling, agahan na lang natin yung board exams nitong mga nurses to take their board exams. I think it was scheduled on December. Nire-request natin, nire-request ng IATF, baka pwede nang gawin ng June so that by July may mga fresh graduates and freshly licensed nurses na tayo na pwede na rin ho natin makasama dito sa ginagawa nating response.
Thank you, ma'am. From Aiko Miguel, Clarification po, the Moderna vaccine can be stored at -20 degrees Fahrenheit or normal freezer temperatures. So same po ito sa Sinovac and Astra na normal freezers po.
Ang Moderna ay different from Astra and Sinovac when it comes to storing it, no? So sabi nga nung EUA niya, it's you store frozen between -25 to -15. Okay? So pwede mo siyang ma-store dito sa normal na 2 to 8 protected from light for just 30 days. Pero ang normal storage situation niya at requirement is really -25 to -15. Compared to Sinovac and AstraZeneca na ang kanya talagang storage requirement is just 2 to 8 degrees. So itong Moderna, with this kind of para bang logistical requirement, sinasabi niya, syempre magta-transport tayo ng mga bakunang yan, syempre magpupunta yan sa mga implementing units. So merong nakalagay dyan na kolatilya na maari mong i-store yan sa 2 to 8 degrees basta protected from light and only for 30 days. So ito po yung nakalagay sa EUA ng Moderna.
Maraming salamat po, Yusek. I think on that note, we can end the briefing po in order to give way to the laging handa with Yusek Mirna. Ma'am, if you have any reminders po before we end today's briefing.
Yes, unang-una gusto ho namin magpasalamat sa inyong lahat. Again, we know that you are our partners in disseminating the correct and right information. So sana po yung updates namin kanina that we are going to have this reformatting of how we give information to the public ay masuportahan nyo rin po. This is really because we would want to extend our reach to our stakeholders na magkaroon na mas closer engagement with them so that we can explain things better to them. Hindi ho mawawala ang ating regular Viber group. If ever you will still have questions during those days na wala tayong media forum, we will still entertain that. But please be mindful of our cut-off. So ang DOH po kaugnay ng iba pa hong panel of experts ay patuloy po kami nakaantabay sa mga nakikita nating variants sa ating bansa. Nakakasiguro po tayo na ang aming masusing pagsusuri at ang patuloy na pagmamatsyag sa ating case trends ay nakatuon sa pagtitiyak na ligtas po tayong lahat. Gayunpaman, muli pa rin ho naming ipinapaalala sa inyong lahat na tayo po dapat ay laging nag-iingat at susunod sa mga health protocols. Nananatili pa rin pong bilang pangunahin nating depensa laban sa pagkahawa sa anumang uri o variant ng COVID-19 ay ang pagprotekta sa ating sarili, pagprotekta sa ating pamilya at pagprotekta sa ating komunidad. So habang patuloy pong kumikilos kami sa gobyerno upang protektahan ang bawat mamamayan, maiging kumilos din po tayo ng ligtas at naaayon sa pag-iingat sapagkat responsibilidad po nating lahat na mamamayang Pilipino na tiyakin po na ligtas tayong lahat dito sa ating bansa. So itatak po natin sa isip at sa puso natin na kailangan po natin lahat mag-ingat, kailangan po nating isipin hindi lang po ang ating sarili, maging dapat isipin ang ating mga kapamilya, ang ating mga kapitbahay, ang ating komunidad at ang ating buong bansa. Maraming salamat po sa inyong lahat and we will see all of you on Friday. Thank you.
Thank you, ma'am, and to all our media partners.